Hello and welcome to Cambridge Clinical and to this session which discusses medical ethics. The fundamentals of medical ethics form the foundation on which all of the situational judgment tasks are based, and so it's really important you've got a sound grasp of what these fundamentals are and why they're important. You may have already heard of the so-called 4 pillars of medical ethics. This term refers to the fact that there are 4 main principles that must underpin every choice we make as doctors and indeed as medical students. The first is beneficence, the duty to do good. This goes hand in hand with the second one, non-maleficence, which is the duty to do no harm. These might seem similar, however very often in medicine a good action will also cause significant damage, and so it is important that we keep in mind the balance of these 2 principles to see whether or not such a procedure would be ethical. The next principle is autonomy, which is arguably the most important of them all. This can be summarised as the right of a patient to choose, be that the choice of what treatment they get, how they receive it, or if they even get it at all. The reason I say this is so important is that the patient's views on a treatment can often dictate whether it is beneficent for them. If we do something that we consider to be doing good, but the patient does not want us to do it, are we really doing good? Indeed, are we in fact doing harm? So you can see that the first 2 principles are, in many respects, governed by the third. The final of the 4 pillars is that of justice, which pretty much just means fairness. This is a much more wide-reaching principle than the other 3, as it is often at its most relevant when discussing patients en masse or healthcare policy rather than individuals, but it still does come up in UCAT questions. So in the UCAT, you'll be given a scenario and a list of possible responses to it. The question then is, how can we assess whether or not these responses are in line with our 4 pillars and to what extent? To check whether a statement fits in with the principle of beneficence, here are some questions you might ask yourself. First of all, will the suggested course of action lead to the best outcome for the patient? Secondly, is the patient being prioritised? Third, will the suggested course of action meet the patient's expectations? This is once again going back to that idea of autonomy governing everything else. Finally, is the course of action proportionate to the condition being presented with? Are we over-treating or are we under-treating something? With regard to non-maleficence, you might want to ask yourself, will the suggested course of action put the patient at risk? If it does put the patient at risk, is this risk outweighed by the potential benefit? So that's the comparison between the pillars of beneficence and non-maleficence again. Is the patient being treated with dignity? And are you personally capable of performing the suggested course of action? Often in the UCAT questions, you'll be presented with a scenario where a medical student is on the wards, and you've got to remember your competence in that scenario. So here's an example of one of the situational judgment questions where the principle of non-maleficence is being assessed. The question reads, Arnold, a medical student, is completing a placement in a local hospital and is observing a consultant, Dr. Matcham, complete a ward round. Dr. Matcham is talking to a patient whilst writing him a prescription for an antibiotic, which a nurse will then administer. Dr. Matcham then receives an urgent request and leaves the ward. Arnold reviews the notes and realises that the patient is allergic to the antibiotic prescribed by Dr. Matcham, and you are then asked, how appropriate are the following responses? I've chosen just one of them to talk through today. So the response is, inform another doctor on the ward about his concerns regarding Dr. Matcham's prescription. So why not pause the video now for a second and have a think about how appropriate that is? The answer is that this is a very appropriate response, as it's an action which directly reduces the risk of harm. Indeed, it's in keeping with non-maleficence. If Arnold didn't do this, there's a risk of serious damage due to the allergy. Moving on to autonomy, it's often fairly obvious if a patient is being made to do something completely against their will. However, in more subtle cases, here are some questions you can ask yourself to assess whether a seemingly autonomous patient is indeed autonomous. So first of all, does the patient fully understand the procedure they're going to have? Secondly, Have you told the whole truth about it, all of its risks, all of its benefits? Third, have you explicitly received consent? So that is, to the treatment, to the person who will be performing the treatment, and the way in which it will be performed? A good question to make sure that the consent you've received is true consent is to ask yourself, if you were to ask the patient to repeat what you'd just told them, would they be able to? That really assesses if they've understood the procedure well. The final question to ask yourself is that if a patient's autonomy does seem to be compromised, are there any exceptional circumstances which justify that? For example, is the patient posing a risk to other people? Here's an example of another situational judgment question, this time assessing your understanding of the principle of autonomy. It reads, a 7-year-old patient, Jessica, has arrived at the hospital with her mother, Germaine. After conducting an examination, Pauline, a medical student, determines that Jessica is having an asthma attack and needs an inhaler with medication to treat her asthma. After explaining this, Germaine tells Pauline that she does not believe in medicating her child. She tells Pauline that she prefers to use herbal remedies. It is important for Jessica to use the inhaler to prevent her asthma from getting worse. So the question you're asked is how important to take into account are the following considerations. And once again, I've just given one, which reads that Germaine has a right to decide how to manage Jessica's treatment and care. So again, pause the video now and have a think about how important that is to take into account. So this is once again very important, and it's a good example of how the ethical pillars can sometimes contradict each other. For example, here, our principle of beneficence is surely telling us to give the medication. But remember that the principle of autonomy always overrides this, and Germaine has the right to withhold the treatment. Also remember that Jessica is too young to consent for herself, and so that right must go to Germaine. Thankfully, we don't actually have to make the decision as to what to do next, so it's okay to leave it at saying it's just very important to take this into account. So let's move on to the final principle, which is that of justice. Now this is a much broader concept and therefore the questions are a lot broader. But one very useful one to ask is the action you're going to take legal? Often if something is not just, it's also illegal. Ask yourself as well, if this action occurs, would any individual's rights be compromised? And finally, the simplest thing to ask is, would your action be described as fair? So one last example then from the UCAT questions. It reads, Levi is a medical student and is observing a doctor who is seeing patients at a clinic in the hospital. The patients have pre-booked appointments, but the clinic is running 30 minutes behind schedule due to staff shortages. Levi leaves the private consulting room to collect some paperwork that the doctor needs for the current consultation. Whilst passing through the patient waiting area, a patient approaches Levi and complains in a raised voice about the waiting time. She demands to be seen next. So how appropriate is this following response? The response being to tell the patient to calm down and agree that the doctor will see her next. So for one last time, just pause the video and have a think about that. So I hope you answered, this is a very inappropriate response. Not only is it just rude of the patient, the main thing is it's not just to allow someone to skip the queue just because they've spoken in a raised voice. We have to consider the fairness of all the patients. And so that sums up our 4 main ethical pillars of medicine. I hope that gives you a good understanding, which you'll be able to apply in the further videos.